girl. So hi, I'm Rachel, and this is Esther. We have brought her in because very soon she's going to be meeting, hopefully, her new forever home. So we got someone coming in to look at her, and I figured now would be a great time to do just a little bit of demo. To my knowledge, she's not had any body work done on her before, so this will be new for her, but that's okay. And today we're just going to demonstrate some of the very basic techniques that I use during a bodywork session and kind of how it would look. It is important to note that every bodywork session is completely different and goes based off of the horse. Kind of what they tell me and what I see and what I feel. She's a little nervous, so we're going to go real slow today. But what I'd like to do is first go over the 5 basic strokes that we would use for like a Swedish or sports massage for a horse. They're actually the same as for a person. And then go over an assessment. So when I first meet a horse, I usually like to start with some form of bonding. Personally, I kind of send myself out just a little bit and wait for them to kind of meet me. Before I just kind of walk up in their space, because just like you don't appreciate when somebody walks right in your personal bubble, it's kind of rude to do it to a horse as well. Yes. But once I know that they're okay and they're comfortable with me and their space, I do what's called an assessment. So it's a combination of a visual inspection of the horse just to see if I can find anything obvious that might be going on. Hi, girl. Hi, girl. And then I like to do what's called a bladder meridian sweep, which is basically, long story short, just a broad sweep from over the face, down the neck, down the body, over the rump, and down the back of the leg, which I won't do the back of the leg just because she and I don't know each other that well, and like I said, she is nervous. But what this does is it lets me feel very gently anything that may feel like tight or a temperature that's off. So that way I can kind of go, oh, okay, maybe I need to come back to this. And then that'll tell me when I actually get into the session, hey, red flag, come check this out. So my first look that I can see, hi, baby girl, see for Esther, is I like to not always start in the face because not all horses like you, like I said, in their face. It's their personal bubble. Some do. But I like to look at her chest, her legs, if she'll let me touch them. And then I go into the bladder meridian sweep. So let me check her pecs real fast. And what I will say is I'm only going to demonstrate on one side, but I would do this on both sides. So let me check her pecs real fast. Because what I can tell if her pecs are, if one's like down here and one's up here, that tells me that there may be some tightness going on, or maybe the muscles have developed a little differently. It's kind of like a signal for me to check out the pectoral muscles, some of the neck muscles, anything that kind of connects and supports. Hi, baby. It's also a little harder with a big belly. So, hi. With just a quick visual inspection, she's pretty squared up, which is nice and makes it easy for me. Her pecs look good. There are actually quite a few pectoral muscles. But her descending pecs, that's the big, like, boobs on a horse, right? They're not super developed, but they don't feel tight. They're not sensitive. She's letting me pet all over them, which is really nice. She's actually let me do a lot, which is really good for the first time. Good girl. You're a good girl. Another easy visual thing that we can do, and it's kind of just like a little trick, is you can look at the mane and the neck, and if you see any hair that's like off to the wrong side, it's an indicator that something's probably up, either with the muscles, the nuchal ligament, maybe one of her cervical vertebrae. Again, it's just a little, hey, notice me kind of sign. Doesn't necessarily mean or guarantee anything, but it's just something for me to see, so it's part of my visual inspection. There's a big girl. Yeah. So going down her body, just watching her her lumbosacral junction, which is sometimes raised in horses. I mean, depends on how they're standing and so on. It does look a little high, and there's a big divot on the other side, which while I'm still learning, and so I'm still getting a feel for a bunch of different horses, that does feel a little off to me. So when I get into a full body work session, I would just mark, hey, check out that junction, check out the glute muscles, or any other muscles that may be pulling on that vertebrae. And a junction is where two vertebrae meet. So it's her lumbar section of her spine and her sacrum, or the fused sacral vertebrae of her spine. Good girl. So now that I've done kind of the visual, I may step back, look at her. I see her pasterns are a little low. They look like they've fallen a little bit, but that doesn't necessarily mean there's a pastern problem. It could just be it's time for her to take a trim. It could just be the angle I'm standing, so I kind of need to walk around her. But that's part of the visual inspection as well, or the assessment. I can watch her breathe. I can see if anything looks like it's tight. There's a good girl. I know, baby. You're calming down a little bit. It's not so scary with some sweet feet, huh? So yeah, I would do that. And then I would do this around the entire horse. Once we work up to it, I would actually stand behind the horse as well. So if you're standing behind the horse, what you can do with a visual assessment is you can look and see if the horse is standing square, because if they're cocked, it's going to be a little harder. If you can get them to stand square, is their butt tilted? Are their hips tilted? Does anything look a little crooked? Is anything super, super tight? She's cocked a little bit, but this also is a really good, so this is that rear view of the assessment that I was talking about. And there's that hard divot. So again, the angle is not abnormal, but what I was feeling is there's a raise right there. That's a normal raise. It's focusing on my finger. Good girl. You gonna give me your butt? Don't back up too much. Here we go. You see how that left hip is higher than that right hip? That's what I want to focus on if I can get to her. Usually I can get a good feel for like the hamstrings and our glute muscles with the bladder meridian sweep. So I'll go ahead and demonstrate that. So what it does is it starts on the inside corner of the eye, goes up between and around the ears, down the neck, and down the spine. Hi. Sweet girl. It's okay. Shh. You're all right. Did something startle you? Yeah. I don't think she's going to let me do her face right now, so I'm not going to do the inside of the eye, so it'll be a partial sweep. Hi, baby. You're all right. So we're just going to start up here, and I'm just going to do my sweep. I like to do two hands, because sometimes one hand will pick something up, but the other might not necessarily feel. I'll do my sweep. I come down. Good girl. You're on my foot, baby. Thank you. Highly recommend steel toe shoes when working with horses, especially big girls or boys. So I'm going to feel down her spine. And here the bladder meridian actually breaks into two. Am I going too fast? I can slow down. Breaks into two. And what's really cool is I can feel her muscles, both the superficial and the deep. Okay, back up for me. Good girl. Moving, which is really cool. So I would go down her back. She does not seem to like that, so we're going to pause. Ideally, I would go down all the way down her back, over her butt. Good girl. And if she would let me down the inside of her leg up to her, or down to her hock. Good girl. And see if I can find any tension. Now she is standing. I'm not sure if you can see it on the camera, so let's see if I can tilt just a little bit. This is what I was talking about. So this part of her spine is raised, and there's a hard divot, which isn't abnormal because that vertebrae, easy. Easy, baby. That vertebrae, the fused sacral vertebrae, is kind of tilted down, so it's not abnormal to see that. But what has caught my eye is the muscles. Easy, Esty. The muscles, there's just a different, kind of an awkward divot. Good girl. Easy, Esther, easy. Awkward divot. And it's very cold, which just means it can be different things since different body workers feel different things. You might actually have a great view of it right now. So it comes up and dips down, which isn't weird, but there's a muscle and it's like a cup. And that can be caused by different things. There could be spasms, making the muscles look slightly irregular. It could just be tight. There's different things that could mean, and I would have to kind of dig in there and explore, but every time I touch it, she gets antsy, so that just tells me that it's sensitive and I need to proceed with caution. And because this isn't a full body session demonstration, I'm going to give her some peace. Esther, back. Good girl. As while I'm here, I've checked the top line, right, which is kind of what, good girl, what the bladder meridian sweep does, but then I can start to explore, right? So she's got a real thick neck that she does not want me to show you. Let's take a walk. Let's take a walk. So she's got a really thick neck. Easy. And so what I want to do is I want to explore her neck muscles, because there's a really big one called the brachiocephalic. It kind of follows the vertebrae and goes into her chest, and that should have some wiggle. So what I like to do is, now we're going to get into the actual strokes, is I like to start with a little bit of vibration, and all that is I'm just moving my hands back and forth on the muscle, putting a little bit of movement, and it's waking up the muscle, it's bringing some blood flow. I know, baby. All right, so we're going to do take two. Esther had about enough of me in her space. She's not used to a stall. She got a little stressed, so we're giving her a break. And so I've got Tessie here with me, and so we're going to kind of pick up where I left off. So we're going to go into a demonstration of the 5 different strokes that we use when doing like manual massage and muscle work or soft tissue work. So when I did the bladder meridian sweep, Tessie's a good girl, yes. So you would come up, around, and then go down the neck. So that's the part that you didn't see. And then these long strokes that I was using, right, going down her neck, down her back, these long strokes, and they can be anywhere from like feather light pressure to kind of digging in there. Tessie really doesn't need me digging in, so I'm not going to demonstrate hard pressure. That is called effleurage. It's a really good opening stroke. When you think of you just petting your horse, you're actually using effleurage. But when I do it, I'm using it to not just pet her, but to feel. So my hands are kind of putting out little feelers, and I'm feeling her muscles, and I'm feeling the tension and the fascia underneath the skin and in between the muscles, because these are the best sensors that you've got. So that's effleurage. Now where I left off with Esther, we were going into friction, and I'm going to demonstrate right here on Tessie's neck. So there's different ways you can do different holds, and again, this just brings energy. You're not really into that, are you? Hi. This brings energy, kind of opens up the cells, try and get some blood, loosen up this muscle. So she's got a really hard spot. It wiggles, right? So you can see the skin moving real easy. So there's no stuck fascia. However, when I feel down her neck, right here feels really hard. Okay. Now it is over one of her vertebrae, so I do have to keep that in mind, right? Because you can feel the cervical vertebrae underneath the muscles. Nice, sweet girl. You're just precious. So I had to keep that in mind. But it does say like, hey, maybe I should check this out, right? And normally I wouldn't just stop there. I would continue with my assessment. But since I've already demonstrated what an assessment would look like, I can go ahead and kind of focus on our neck area just because it's real easy to see. Another stroke that we could use, and I can use it right here on this muscle, the brachiocephalic, that's this big fat neck muscle. You can also use it on the top, on their crest. It's called petrissage. And in a human, that's where you're like kneading the muscle, really, really getting in there, right? So what I can do is I use like a C-grip, or I cup my hand, and I can kind of knead this muscle, not too hard, because I'm just trying to get the muscle to relax a little bit for me. Oh, you like that, huh? Hi, baby. Can you move your head so they can see? Yeah. So you can massage there. You can do it at the top. I really like that. I call it like doing the laundry because, you know, old school laundry, you take it and you shake, but I'm kneading and I'm shaking that nuchal ligament right here at the top, right? And I'm just making sure it's nice. Hers is nice and loose, which is good. We like that. Hi, honey. Hi, honey. Yes. Oh, yeah. And then right here, here's a good demonstration. This is called friction. Usually it's a circle, and it can be varying pressures as well. We're just causing warmth with the movement of our hands. We're using friction, right, to warm up that area. Here's a good girl. A good girl. Okay, so I noticed that my phone, which I edited out falling because Tessie hit it with her nose, but when the phone fell, it missed the entire 5 strokes that I tried to review. So we covered effleurage, we covered vibration, which is what I was doing with Esther, not friction in the beginning. We covered friction, which is when I was doing circles on Tessie. Petrissage, which was the kneading. And then the last one that I'm about to go into is tapotement. And this can be done down the back, it can be done on the legs. What this is it's a tapping. It's a tapping motion. And it can be a whole cupping of your hand, it can be a single finger. And this is again meant to kind of draw attention to the muscle. It can be for the horse to start paying attention to where you are. It could be to try and draw blood flow to a single position. So like on Esther where I saw that divot, I could try and feel around. I don't know if I would use tapotement there, but it's to draw specific attention to one spot, right? And it would look like this. Tessa. Good girl. So if I were to start going down her spine, good girl, it would look like this. Just a gentle cupping, because I want to wake up her spine and let it know, hey, I'm coming to you. You're next. And then you can follow it up with some effleurage, which again is that long stroke. Right? It's really good on the glute muscles or the hamstrings when they're really tight and you really want to just wake it up. It's another kind of wake up sensation. So it doesn't get super deep unless you put a lot of intention into it, but that'll be another video explaining that. Good girl. I know, we gotta take care of that knee. Mwah. But yeah, so we've covered the 5 strokes and then a visual assessment and the bladder meridian sweep.